When she told me normal blood sugar is between 4 and 8, and mine was 15. I was shocked, scared. It was like, wow, like a bombshell.
If left untreated, high blood glucose levels can lead to serious complications.
Most people with diabetes will die of a heart attack or a stroke due to damage to the large blood vessels. It can damage the kidneys, and that's why people with diabetes are more prone to kidney failure and can end up on dialysis.
Hugely scary. It's like, okay, if you do not control this disease, you're just not going to be around.
Central to managing your diabetes is keeping your blood glucose in check. Everything from what you eat to your exercise program will affect your levels. Number 1, find out your target blood glucose range. This is something you need to discuss with your family healthcare provider or a diabetes educator.
Okay, and when did you last eat?
Just before I came.
Our targets for blood glucose control, the Canadian Diabetes Association targets, are 4 to 7 before meals and 5 to 10 measured 2 hours after the start of a meal. Now, there are some medications that can be used that can cause low blood glucose, but again, those are typically not used early on.
To learn more about low blood glucose, check the fact sheet on managing your blood glucose. Number 2, learn how to use a glucose meter. Talk to a diabetes educator or pharmacist for help finding the device that's right for you.
They know that it involves poking their finger, and they really are afraid of it. I show them that these devices are made to cause the least discomfort possible, and little tricks to do that.
Number 3, test your blood glucose on a regular basis. Regular testing will allow you to understand how exercise or different foods affect your levels.
I tell them it's homework, but if they do it, it's going to tell them invaluable information. Then, as they are starting to implement some of the changes that we've suggested, if they can see the change, that's very motivating.
It worked really well. If I ate something and my blood sugar was really high, it's like, okay, maybe I better not eat that or adjust the portion.
Number 4, if you are sick, check your blood glucose more frequently. It tends to be unstable during an illness. Number 5, eat well and exercise. Throughout this series of videos, you will hear more about the critical role food and fitness play in managing your diabetes. It improves your well-being and it keeps your blood glucose on target.
Once your blood sugar is under control, you'll feel benefits. And that can happen remarkably quickly. If someone comes in and they're very symptomatic, symptoms will ease within days of their glucose level being in check. It doesn't take a long time.
I feel better. I have more energy. I mean, the only thing that reminds anybody is my medical alert bracelet that I'm diabetic, because otherwise you wouldn't know.